Hi, and here we are on episode 29 of the Perio Patient Podcast. And we left off 2 times ago on sort of a cliffhanger, trying to understand what it was these reviewers of studies concluded about water fluoridation. And if you are confused and don't know what I'm talking about, I'd recommend you go back to episode 27 at least, and maybe also listen to some others on the fluoride topic. But I'll back up just a little. They searched for reports from studies and databases representing the world's scientific information. In other words, there was no language barrier on the studies they reviewed. And based on their criterion for inclusion, they found a total of 155 studies. That alone is a lot of reading. From there, they pared it down to 107 studies. And I know, okay, we get confused on the numbers. Just remember that these folks have done a lot of research on databases to find studies that they can link to their topic. And with their data research, they pulled out 155 studies. And out of those 155 studies, they went into detail to discover that a little over 100 of them had sufficient data for them to compare their results together. In other words, they threw out the others. Now, assuming they were good at their jobs of bringing data together from different studies designed differently into something larger, here's what they found. Again, we're looking at the question about whether or not fluoridating the water reduces tooth decay, primarily in children. In baby or deciduous teeth, the initiation of water fluoridation lowered the number of teeth with decay by just under 2 teeth per child. In permanent teeth, it lowered the decay level to about 1 tooth per child. This translated into a 35% reduction in decay in baby teeth and 26% reduction in decay in permanent teeth. So what do we conclude from this? Well, number one is water fluoridation does not eliminate decay in children, but it does reduce it. And if you can reduce something by 1/4 or 1/3, that's pretty significant. That's 1 less toothache a child would face or in a permanent tooth, or a problem with a permanent tooth, and also with baby teeth. Okay. In addition, though, they found that there were also increases in the percentage of caries-free children of 15% in the deciduous dentition and 14% in the permanent dentition. All right. That's good too. Those are good numbers. You could increase the number of children who don't get any decay simply by water fluoridation by about 15%. That doesn't sound bad. But then there's something else we need to know. The report goes on. The majority of the studies, 71% of them, were conducted prior to 1975. That's 45 years ago. That's a few generations back, I would think. And the widespread introduction of the use of fluoride toothpaste. So, fluoridated water, been around for 75 years. Fluoridation, big discovery. But then they began to put fluoride into toothpastes. And I think I'm taking from this study, because I don't know exactly when it started, that was roughly in the 70s. I bet it was more in the 1960s. But they began to fluoridate toothpastes. Now, fluoridated toothpastes were not intended to help in the development of teeth. Fluoridation of toothpastes has more to do with surface changes. And that's an entirely different topic. But what is true is that if it is in the toothpaste and people swallow the fluoride, it can incorporate both into bone and into tooth. And that could occur more with children. I would be very careful with children with fluoridated toothpaste, especially under the age of 2. Just a thought. There is insufficient information to determine whether the initiation of water fluoridation programs resulted in a change in disparities in caries across socioeconomic status levels. In other words, they couldn't determine if, based upon income, whether or not fluoridating the water made a difference. You see, the public health message and justification of water fluoridation 75 years ago was that it would reduce decay in all socioeconomic levels and would therefore benefit poor children the most. But is this still true today, especially in the United States? There is insufficient information to determine the effect of stopping water fluoridation programs on caries levels. So, what would happen if we stopped fluoridating water? Well, it depends on what we mean. Do we mean allowing fluoridation levels to return to whatever they were before in those water sources? In some areas, that would increase fluoridation, and that's not a good idea if the fluoridation levels are too high and cause fluorosis. In other areas, it might mean less fluoride, but not the absence of fluoride. And I think there is a good argument, and in fact, I think fluoridation levels have dropped in water over the years. I think in 2015, there was actually a reduction in the parts per million recommended in fluoridating water. So that's actually occurred. But also, how much are we drinking from the public water system today? It appears that most of our water is bottled or run through filters. How does this affect fluoride levels? I don't know. I don't know if the water coming into a particular bottle is that much or if they're filtering that out. So you can see how complicated all of this becomes. No studies that aimed to determine the effectiveness of water fluoridation for preventing caries in adults met the review's inclusion criteria. In other words, if there was anything about adult caries and water fluoridation, there weren't enough studies to combine to make any comments about. But again, I would go back to why are we talking about children and not adults? And the answer there again is it's the incorporation of the fluoride ion into the developing tooth structures, and that only occurs in children. And that seems to be where you get your strongest enamel. It's when the fluoride crystals, the fluoride in the hydroxyapatite crystals are throughout the crystal of the enamel. But again, people are talking about using fluoride as a surface treatment, but it isn't the same. It's a different subject, and it's really off what we're trying to determine here. With regards to dental fluorosis, this is them, where I'm quoting, we estimated that for a fluoride level of 0.7 parts per million, the percentage of participants with fluorosis of aesthetic concern was approximately 12%. That's a little high. You don't want to see that if that's a complaint. This increases to 40% when considering fluorosis at any level, meaning detected under highly controlled clinical conditions, meaning that dentists are looking at the teeth very closely and finding fluorosis that no one is complaining about. Then the incidence is higher at 40%. But 12% are saying, my teeth don't look good. So that's at 7 parts per million. So you got to reduce it from there. The other thing they said, over 97% of the studies were at high risk of bias, and there was substantial between study variation. What do those mean? High risk of bias means that a study design could have been designed in a way that leans toward a certain finding. And substantial between study variation, if there's a lot of variation between studies, again, when you're trying to bring their data together, that makes it extremely difficult to come to conclusions. And sometimes these honest researchers will simply say, I can't bring the studies together and make anything out of them. You're just going to have to read them separately and come to your own conclusions. We can't have a meta-analysis with these two studies. So let me end with the author's conclusions. I'm going to end with the author's conclusions, and then I'll give you a few of my own conclusions. Author conclusions. There is very little contemporary evidence meeting the review's inclusion criteria that has evaluated the effectiveness of water fluoridation for the prevention of caries. Now, if we wanted to go further into this, we would go to a rebuttal letter by the Center of Disease Control, or CDC. We've heard a lot about them because of the COVID situation, so you're familiar with the Center for Disease Control. But they have a letter refuting their assertion, this study's assertion, and states that they state that there have been some good, more recent studies. But I think I've pushed your interest level in this topic far enough, and we're not going to go any further into it. Reading on in their conclusion, the available data come predominantly from studies conducted prior to 1975 and indicate that water fluoridation is effective at reducing caries levels in both deciduous, remember that's baby teeth, and permanent dentition in children. Our confidence in the size of the effect estimates is limited by the observational nature of the study designs, the high risk of bias within the studies, and, importantly, the applicability of the evidence to current lifestyles. The decision to implement a water fluoridation program relies upon an understanding of the population's oral health behavior. Example, use of fluoride toothpaste. The availability and uptake of other caries prevention strategies, their diet and consumption of tap water, and the movement, migration of populations. You can see how if people move from city to city, that confounds any study trying to compare water fluoridation from one city to another. You can't keep populations from moving. There is insufficient evidence to determine whether water fluoridation results in a change in disparities in caries levels across socioeconomic levels. We did not identify any evidence meeting the review's inclusion criteria to determine the effectiveness of water fluoridation for preventing caries in adults. There is insufficient information to determine the effect on caries levels of stopping water fluoridation programs. There is a significant association between dental fluorosis of aesthetic concern or all levels of dental fluorosis and fluoride level. The evidence is limited due to high risk of bias within the studies and substantial between-study variation. So that was the author's conclusions. And now let me give you some of mine. The discovery of the link between fluoride and tooth decay was very important. The fluoridation of water was a good idea. The question of fluoridating water is not all or none, but at what levels do we fluoridate when we have it in naturally, because it's a naturally occurring element. Reducing fluoridation levels today over previously set ones when it is found that fluorosis levels in teeth are too high makes sense and may be associated with the fact that people today are obtaining the fluoride they need in ways other than through tap water. So, that's it. We're done. We'll talk about other things next time. Thanks a lot.